Welcome to the Burnade channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for impaired skin integrity. Nursing diagnosis. Impaired skin integrity. Related to mechanical factors, pressure, friction, shear, immobility, moisture, altered circulation, nutritional deficits, or chronic medical conditions, example diabetes, vascular disease. Nursing diagnosis. Impaired skin integrity. Part 2. Evidenced by disruption of skin surface, localized skin damage, redness, warmth, tenderness, change in skin texture, or presence of wounds, pressure ulcers, or skin tears. Desired outcomes. One patient's skin will show signs of healing with no new areas of breakdown within 5 days. 2 patient will maintain intact skin throughout hospitalization and demonstrate ability to identify risk factors for skin breakdown. Desired outcomes. Part 2. 3 patient and caregivers will verbalize understanding of skincare techniques and demonstrate proper care within 24 hours of education. 4 Any existing wounds will show progressive healing as evidenced by decreased size, depth, and exudate within 7 days. Assessment. 1 Perform comprehensive skin assessment on admission and daily thereafter, paying attention to bony prominences and areas of decreased sensation. 2 Assess risk factors using a validated tool, example Braden scale, on admission and regularly as per protocol. Assessment. Part 2. 3 Evaluate patient's nutritional status, including albumin levels and dietary intake. 4 Assess patient's mobility status and ability to reposition independently. 5 Monitor for signs of infection in existing wounds, example increased redness, warmth, pain, purulent drainage. Nursing interventions. Skincare. 1 Implement a regular turning schedule, repositioning patient at least every 2 hours or more frequently if high risk. 2 Use proper positioning techniques and assistive devices to minimize friction and shear during transfers and repositioning. Nursing interventions. Skincare. Part 2. 3 Keep skin clean and dry, use pH-balanced skin cleansers and avoid hot water. 4 Apply moisturizers to dry skin, avoiding massage over bony prominences. 5 Use barrier creams or protective dressings on areas at risk for moisture-associated skin damage. Nursing interventions. Pressure redistribution. 1 Use pressure redistributing surfaces, example specialized mattresses, cushions, as indicated by risk assessment. 2 Ensure heels are elevated off the bed surface using pillows or specialized devices. 3 Avoid positioning patient directly on trochanter, use 30-degree lateral position when side-lying. Nursing interventions. Nutrition and hydration. 1 Collaborate with dietitian to ensure adequate protein and calorie intake for skin health and wound healing. 2 Encourage oral fluid intake of at least 1,500 ml/day unless contraindicated. 3 Administer vitamin and mineral supplements if prescribed. Nursing interventions. Wound management. 1 Perform wound care as ordered, using aseptic technique. 2 Document wound characteristics, size, depth, exudate, tissue type, regularly. 3 Apply appropriate dressings to maintain moist wound environment and protect surrounding skin. Nursing interventions. Patient and caregiver. Education. 1. Teach patient and caregivers about risk factors for skin breakdown and prevention strategies. 2. Demonstrate proper skin inspection techniques, emphasizing areas at high risk. 3. Instruct on proper positioning techniques and use of assistive devices. Nursing interventions. Patient and caregiver. Education Part 2. 4. Educate on signs and symptoms of skin breakdown to report promptly. 5. Provide information on nutritional needs for skin health and wound healing. 6. Teach proper wound care techniques if applicable. Evaluation. 1. Patient's skin remains intact or shows signs of healing with no new areas of breakdown. 2. Patient and caregivers demonstrate understanding and proper execution of skincare techniques. Evaluation. Part 2. 3. Existing wounds show progressive healing as evidenced by decreased size, depth, and exudate. 4. Patient maintains or improves score on risk assessment tool, example Braden scale. 5. Patient verbalizes understanding of risk factors and prevention strategies for skin breakdown. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burnaid app for free from the Play Store or App Store for answers to more than 3,000 questions.